Welcome to Lesson 2 of our Evaluation and Management Coding series. In this lesson, we will learn the first element of medical decision-making, known as COPA, which stands for the number and complexity of problems addressed. Understanding COPA is essential because it helps determine the level of medical decision-making and supports accurate CPT evaluation and management code selection. Before we begin, this training is for educational purposes only. Always refer to the latest CPT, ICD-10CM, HCPCS Level 2 manuals, payer policies, and official coding guidelines when assigning medical codes. Before we begin, let's review the learning objectives for this lesson. In this lesson, you will learn the fundamentals of medical decision-making, or MDM, and understand why it is important in evaluation and management coding. We will discuss the three elements of MDM, with a primary focus on the number and complexity of problems addressed, also known as COPA. Finally, we will explore the four COPA levels: minimal, low, moderate, and high, and see how they help determine the appropriate EM service level. Let's get started. Medical decision-making, or MDM, is one of the most important concepts in EM coding. It is the process a physician uses to evaluate a patient's condition and determine the most appropriate diagnosis and treatment plan. Under current CPT guidelines, many EM service levels are selected based on MDM. Therefore, understanding MDM is essential for accurate coding and CPC exam success. Medical decision-making involves several important clinical activities. The provider may establish or confirm a diagnosis, assess the patient's current condition, and select the most appropriate treatment or management plan. These decisions help determine the complexity of the encounter and support the selection of the correct EM code. Medical decision-making is based on three key elements. The first is the number and complexity of problems addressed, also called COPA. The second is the amount and complexity of data reviewed and analyzed. The third is the risk of complications or morbidity associated with patient management. In the next section, we will begin by exploring the first element, COPA, in detail. In this lesson, we will begin with medical decision-making, commonly called MDM. MDM is the process a physician uses to evaluate a patient's condition and decide the most appropriate diagnosis and treatment plan. It includes establishing diagnoses, assessing the patient's health status, and selecting the best management option. Medical decision-making is one of the most important concepts in current EM coding because many office and outpatient EM codes are selected based on the complexity of MDM. MDM is based on three important elements. The first element is the number and complexity of problems addressed during the encounter. The second element is the amount and complexity of data reviewed, such as laboratory tests, imaging studies, and medical records. The third element is the risk associated with patient management decisions. These three elements work together to determine the overall medical decision-making level. There are four levels of medical decision-making. These are straightforward, low, moderate, and high. A simple patient encounter usually falls under straightforward or low MDM, while patients with multiple complex conditions or high-risk management decisions may qualify for moderate or high MDM. Selecting the correct MDM level is essential for accurate EM coding. An important CPT guideline is known as the 2 out of 3 rule. To assign a particular MDM level, at least two of the three elements must meet or exceed that level. For example, if the problems and risk are moderate, but the data is low, the overall MDM level is still moderate. This rule is frequently tested on the CPC examination. Let's begin with the first element of medical decision-making, called the complexity of problems addressed, or COPA. A problem may be a disease, illness, injury, symptom, sign, or complaint. A problem is considered addressed only when the physician evaluates, treats, or manages it during the patient encounter. Simply listing a diagnosis in the medical record is not enough. The physician must actively address the condition. Remember, only problems addressed during the encounter contribute to the medical decision-making level. During a patient encounter, the physician may evaluate more than one medical condition. These may include new problems, existing chronic conditions, or multiple illnesses managed during the same visit. The physician may also consider additional testing, treatment options, or the risks and benefits of different management plans. As the number and complexity of addressed problems increase, the overall medical decision-making level may also increase. Understanding which problems are addressed is essential for accurate EM coding and CPC exam success. Now let's discuss comorbidities and how they affect medical decision-making. A comorbidity is an additional medical condition that exists along with the patient's primary condition. However, simply having a comorbidity does not increase the MDM level. It only counts if the physician evaluates, treats, or manages that condition during the encounter. For EM coding, always remember that only addressed problems contribute to medical decision-making. Another important concept is referrals. When a physician evaluates a patient and decides to refer the patient to another healthcare provider, that referral is considered a management decision. However, simply documenting that another physician is managing the condition does not count toward medical decision-making. To receive MDM credit, the physician must actively evaluate, coordinate, or participate in managing the patient's condition. This distinction is important for accurate EM coding and is commonly tested on the CPC exam. Let's discuss referrals in medical decision-making. A referral alone does not count as a problem addressed. Before referring a patient, the physician should first evaluate the patient's condition by reviewing the history, performing an examination, or assessing diagnostic test results. The physician should also consider appropriate treatment options before making the referral. Only then can the referral contribute to the medical decision-making process. For hospital inpatient and observation services, medical decision-making is based on the patient's condition on the date of the encounter. This may be different from the condition that originally caused the hospital admission. The physician should focus on the problem being actively evaluated or managed during today's visit. Let's begin with the first COPA level, called a minimal problem. A minimal problem is a condition that may not require the direct involvement of the physician or other qualified healthcare professional. These services are often provided under the physician's supervision and involve very little medical decision-making. Because the complexity is very low, minimal problems usually support the lowest level of medical decision-making. The next type of problem is a self-limited or minor problem. These conditions usually follow a predictable course and are not expected to cause permanent damage to the patient's health. Common examples include the common cold, mild seasonal allergies, a minor skin rash, or a simple viral upper respiratory infection. Although these conditions require evaluation, they generally involve minimal complexity and support lower levels of medical decision-making. An acute, uncomplicated illness or injury is a recent health problem with a low risk of complications. Most patients recover completely with appropriate treatment. Common examples include allergic rhinitis, a simple sprain, minor pain, and non-bacterial acute sinusitis. These conditions usually involve low-complexity medical decision-making. These are common examples of acute, uncomplicated illnesses or injuries. They are short-term conditions that usually improve with treatment and have a low risk of complications. For CPC exams, remember that these conditions generally support a low medical decision-making level when supported by the provider's documentation. This type of problem refers to a recent or short-term illness that requires treatment in a hospital inpatient or observation setting. Although the patient needs hospital-level care, the overall risk remains low, and recovery is generally expected. In EM coding, always identify the care setting before selecting the appropriate code. A stable acute illness is a recent condition for which treatment has already been initiated. The patient's symptoms are improving, but complete recovery may not yet have occurred. For CPC exams, remember that a stable acute illness usually indicates the patient is responding to treatment while still requiring appropriate follow-up and monitoring. An acute illness with systemic symptoms affects the body beyond a single local area. Patients may experience symptoms such as fever, body aches, or fatigue. If left untreated, these illnesses may lead to more serious complications. In EM coding, systemic symptoms usually indicate a higher level of medical decision-making than a simple acute illness. Examples of acute illnesses with systemic symptoms include pyelonephritis, pneumonitis, and colitis. These conditions often require additional evaluation, diagnostic testing, and treatment. For the CPC exam, remember that systemic symptoms generally increase the complexity of medical decision-making, so always review the provider's documentation before selecting the EM level. A chronic illness is a medical condition that lasts for at least 1 year or may continue throughout the patient's lifetime. These conditions usually require ongoing monitoring and treatment. Common examples include hypertension, diabetes, and asthma. In EM coding, chronic illnesses are evaluated based on whether they are stable or unstable. A stable chronic illness is a condition that is well controlled and meeting treatment goals. The patient has no significant worsening of symptoms or complications. Examples include controlled hypertension, stable diabetes, stable cataract, and stable BPH. Remember, stable means controlled, not cured. An unstable chronic illness is a condition that is not meeting treatment goals or has worsening symptoms. These patients may require medication changes, additional testing, or closer follow-up. Examples include poorly controlled hypertension and uncontrolled diabetes. For CPC exams, unstable chronic illnesses usually indicate a higher level of medical decision-making than stable chronic conditions. This category represents the highest level of complexity in the COPA element. It includes acute or chronic illnesses that threaten the patient's life or a major bodily function. These patients require urgent evaluation and aggressive management. Examples include severe acute illnesses, worsening chronic diseases, and complicated injuries. These conditions usually support high medical decision-making. Let's look at some common examples. Acute myocardial infarction, pulmonary embolism, severe respiratory distress, peritonitis, acute kidney failure, sudden neurological changes, severe rheumatoid arthritis flare, and psychiatric conditions with risk of harm are all considered high-complexity problems. For the CPC exam, whenever you see a condition threatening life or a major body function, think of high MDM. In this lesson, we learned the first element of medical decision-making, COPA, or the number and complexity of problems addressed. We covered the 4 COPA levels, common examples, and important CPC exam tips. Remember, to assign the final MDM level, at least 2 of the 3 MDM elements must meet or exceed that level. In the next lesson, we'll learn the second MDM element, data reviewed and analyzed. Thank you for watching, and don't forget to like, share, subscribe, and continue learning with KS Medical Coding Academy.